Thank you and good morning, Chairwoman McCarthy, Ranking Member Platts, and other distinguished members of the subcommittee. On behalf of CDC, it is an honor to be here. I serve as the Director of the Division of Violence Prevention at CDC's Injury Center. Today, I will highlight that public health can complement child welfare and protective services by bringing proven prevention strategies to scale. This involves three key points. First, that public health has an important role to play in preventing child maltreatment. Second, that we have the opportunity to put in place innovations in how we prevent child maltreatment through evidence-based strategies. And third, that scaling up these approaches necessitates partnerships between public health, social services, and child-serving entities to ensure quality. We know that child maltreatment has significant short and long-term health consequences. For example, in 2007, an estimated 1,760 children younger than 18 years of old died as a result of maltreatment. We also know that approximately 794,000 children were determined by state and local child protective services to be victims of child maltreatment. These numbers, no doubt, are an underrepresentation because the data only reflect cases that are reported to the Child Protective Services system. But we also know that exposure to child maltreatment has long-term health consequences into adulthood, such as heart disease, cancer, drug abuse, and depression. Moreover, studies show that exposure to child maltreatment is linked to other forms of violence, including youth violence and intimate partner violence. There is a wealth of evidence showing the needs of children for healthy development. First, we know that children need to be safe from physical and psychological harm. Secondly, we know that children need a degree of stability in their environment. And third, they need a nurturing parent or other caregiver that is consistently available to meet their needs. The way to reduce child maltreatment is to promote child health. We can do this by fostering safe, stable, nurturing relationships using a public health approach. We are at a critical juncture because we now have prevention programs that work. Now is the time to focus on wide-scale implementation of those programs. Recent CDC studies show that child maltreatment rates actually fall when parents have access to interventions that address problems with child behavior. For example, Triple P, a parenting program, combines broad social campaigns with targeted parenting support services. In addition, early childhood home visitation programs are effective. For instance, the nurse-family partnerships focus on first-time mothers during pregnancy, working to promote positive health and interactions between mother and child. Although there are promising interventions, there are still some opportunities for improvement. We need data that provides a comprehensive understanding of the ideal settings for interventions, and we need a better understanding of risk surrounding child maltreatment. We need to continually evaluate promising strategies, including programs and policies that target at the individual and community levels so that we can widely implement. We need to develop public health capacity to support prevention programs that complement child welfare and child protective services. We must work to make prevention accessible, especially to parents, without stigma. So in conclusion, public health can lessen the burden on child welfare and protective services by bringing prevention strategies to scale and ensuring that they are accessible to all families that need and want them. Scaling up these approaches necessitates collaboration between public health, social services, and child-serving agencies. A partnership between public health and child protection services will allow more people to access programs that strengthen families and help children to live life to their fullest potential. I would like to thank the subcommittee for its continued support of CDC and its injury and violence programs, and I would be happy to answer any questions that you may have. Thank you.